My name is Beth Heidorn, and I'm the Executive Director here at the Racine Zoo. Welcome to Racine Zoo to You. Today's episode, we're going to be talking about animal care with our vet staff. We have some of the best animal care people here, and our animals are very well taken care of. So just like people, sometimes animals get sick, or they have an issue. So we need to make sure that we take care of them, and that is what our vet care staff is doing. So we adhere to the highest of vet care and animal care around. We're part of AZA, which is the Association of Zoos and Aquariums. And the gold standard of all of that care is what we adhere to, and we are proud to do so. So today you're going to meet our vets, you're going to meet our animal care staff that are dealing with all of the animals if they have a problem. We'd like to make sure that we have preventative care, and then we also will have to do care that when we have a problem or an issue. So let's go meet our animal care staff and our wonderful vet team. I think you're going to learn a lot here in this issue.
My name is Tiffany Stry. I am currently the Veterinary Care Program Coordinator and Registrar. I've been at the zoo for 6.5 years, but I started 7 years ago as an intern in the Animal Welfare Program. I was hired on to work with our seasonal camel on our camel rides, and then kept on as the night keeper doing our commissary work for a few years. About 2 years ago, I took over the veterinary program along with registrar duties. And on occasion, I get to get my hands dirty in the animal areas, helping with the primates, the giraffes, and the rhinos. But I spend most of my time here in the hospital keeping track of animals' health, well-being, make sure that the veterinarians' treatment plans are being followed through with, monitoring keepers' concerns, and making sure there's good communication between the animal staff and the keeper staff. What I love about my job is having a hands-on opportunity to affect the well-being and quality of life of animals today. I come in every day, talk to the keeper staff, talk to the vet staff, and we work together to figure out a plan on what is best for the animals and how we can change their life, improve their quality of life, and what they need to have a happy life in the zoo, in our care today.
As Beth just said, veterinary care is paramount to ensuring that our animals have the highest standards of welfare here at the Racine Zoo. And our veterinary care team works very hard to ensure that that happens. Our vet care team includes Tiffany, who we just met. She is our veterinary coordinator and registrar, so she is in charge of listening to the keepers and remembering and learning about everything going on with all of our over 100 species and thousands of individual animals at the zoo. Tiffany knows every animal that has a cut, a scrape, a medical issue that requires chronic care, anything like that. She has it all together, organized, and is able to make sure that treatment for those animals remains consistent. Another member of our vet team is Dr. Kevin Nelson. Dr. Nelson comes to the zoo at least twice a week, every week, to do rounds, check on any new issues that may pop up, check on any continuing issues with the animals, and make sure that we are continuing preventative care for our animals. A lot of people ask what a typical day for our veterinary team is, but there really is no typical day. Our veterinary team, while headed up by Tiffany and Kevin, involves literally everyone in the zoo, from our zookeepers that see the animals every day and are the first line of defense to catch when something might be wrong, even to our educators when they take the animals out in the community, making sure that no animal is exhibiting unusual signs of stress or anything like that. A lot of what our vet team does is preventative care. So most of the time when we're looking at an animal, it's not because there's something wrong. It's because we want to make sure that we can catch whatever's wrong before it happens. You can't just walk up to a bear and say, hey, feeling okay today, got a headache, anything like that going on. So instead, we do have to look a little bit closer and make sure that we do routine checkups on these animals, just like you would do for your pets or for your family members at home. and that is a huge chunk of what they do. A lot of this preventative maintenance we're able to do voluntarily. We've talked a lot on previous episodes about things like trimming the hooves of our giraffes, which they do voluntarily by stepping up on a platform, or taking blood to test from our rhinos when they just lean right against the fence and let the keeper take that blood from their foot. Getting weights is usually as simple as asking an animal to step on a scale. But sometimes we need to get a little bit closer and more hands-on with our animals, especially some of the older animals in our care, to make sure that everything is going smoothly. So today we're going to check out an exam that was done with our Andean bear, Diamond. Diamond is a fantastic bear, but he's getting up into his golden years now, and we want to make sure that everything with Diamond is tip-top shape and that he is healthy as can be. There is a lot that goes into checking on a bear like Diamond, so let's go check out what our vet team's doing and see what a bear exam entails.
Here at the Racine Zoo, we do annual wellness exams for all the animals in our collection. It's our way of getting a consistent baseline for the health and what's normal for all the animals, so it makes it easier for us to diagnose something when there are concerns that do arise. For bears, we usually administer anesthesia because they're not very handleable. So when we consider what goes into an exam, we look at their entire health history, what are the keeper's current concerns, if we've observed anything abnormal recently. We also revisit their anesthesia history so we know what's normal for the process of them going under sedation, for the process of them being under sedation during the exam, and also when they're recovering. We want to know what's normal, so if something abnormal arises, we can step in right away. Prior to each exam, we review an animal's medical history, both their previous conditions, current keeper concerns, as well as anesthesia history, so we can be prepared for any complications that may arise during the procedure. We like to have a baseline so we know what's normal, so if complications do arise, we are prepared to handle those and take care of the animal the best we can. After anesthetic drugs take effect, the animal simply looks like it's sleeping. We give the animal a little bit of time based on history before the vet goes in with the animal to see if they are fully under, administer additional drugs if needed. Once the animal is under working anesthetic, the staff comes in, helps move the animal a little bit, reposition it. Sometimes we lift them up onto a gurney so we can get a better vantage point. Sometimes we leave them right where they are. This allows us to reposition the animal so we can perform any test procedures and physical examinations that we need to make sure that we're checking over the animal's entire health. Since being under anesthetic drugs can be stressful for the animal, we want to try to accomplish their exam in as quick amount of time as possible to reduce the amount of stress on the animal's body. Diamond's exam went great. We were able to look inside his mouth. He has known dental issues, so we're constantly monitoring that. We were able to draw blood for normal evaluation and make sure he doesn't have some sort of illness brewing that we can't outwardly tell at the moment. And we were also able to take some x-rays to monitor his known arthritis condition that we manage on a day-to-day basis with anti-inflammatories and supplements. Thankfully, Diamond got a clean bill of health. Everything went smoothly and he was back on exhibit the next day.
My name's Kevin Nelson, veterinarian with an outside clinic. We're outside vendors of the Racine Zoo. We were brought in gonna age me here, 1991 as a vendor to do the healthcare on the animals, and it's changed dramatically over the years, where we were more or less kind of just emergency, if somebody got sick, treat them or do diagnostics, to more of a full rounded preventative programs that we have at the zoo now. Originally it was one of my former partners and myself that did the work, and then over the years after he retired I took over full time, and I'm at the zoo 2 half days a week is our contract, and it adds a little bit of spice and to my normal veterinarian life. Frequently I'm an equine practitioner. That's 90% of our work, although I do some other odd species, including these guys up here. I'm an outside vendor here at the zoo. I'm not full-time and on staff. Our clinic has been hired, Bristol Veterinary Service, which is located in Kenosha County. We're primarily an equine facility, but I'm kind of our jack of all trades. And it's one of the reasons that we were brought in way back when in 1991 to help here, because my former partner had some experience in exotics from some outside farms that had exotics. So it was a natural transition to bring us in. One of the nice things about working up here is that a lot of times we do the same thing day in and day out on whatever species we're working on. Working with from all the way from a bird to a rhino to a lion or a walking stick or something like that. The variety, and a lot of it is also thinking out of the box, even though we use a lot of our domestic species as models for these guys. And so the negative for me being a general practitioner and not a full-time zoo vet is that I rely a lot on colleagues that are full-time zoo vets. So it's a constant learning curve for me, which is interesting and fun. And then again, thinking out of the box, how do you get an orangutan to take a medication? So I rely a lot on the keepers up here as well as the healthcare staff to help me figure out sometimes what the animals are doing, what's their norm and what's not normal. And it just adds a lot of extra spice, as I call it, to my practice life.
Red is a boa constrictor, and we were doing her annual wellness exam. For a big snake like Red, it requires multiple staff members to maneuver an exam like that. Since she is handleable, we choose not to use any anesthetic drugs on her since we don't want to stress her out needlessly. For an exam like this, we usually have 2 keepers handle the snake while the vet does the physical exam. Things that we look for are scale condition. We do have an ongoing issue with Red where we're monitoring an abnormal scale. That's something that we do monthly to make sure that it continues to look normal. In addition to monitoring the snake's scales and overall integument condition, we always check their eyes, we try to check their mouth, their vent, heart and lungs, and just for any other general abnormalities. Oftentimes for the snakes, we talk about if they're eating consistently, if they're shedding routinely. This is where keepers' knowledge and day-to-day observations really come in handy for us, since we can't be there 24/7 watching if a snake sheds. We rely on the keepers' observations to let us know that the animals are doing what they're supposed to do when they're supposed to do it, and then that there isn't an issue. So on vet rounds today, we visited with some of our amphibians and reptiles. Kermit, our marine toad, Sally, our tiger salamander, and Andre, our Caledonian giant gecko. For their wellness exams, we often take a look at their overall body condition. If we notice any abnormalities, we take a look at their eyes in an effort to decrease the stress on these animals who are not always familiar with being handled. Our vet likes to employ the rubber spatula that we use to try to gently encourage them to open their mouth, allowing us to get a quick peek inside to make sure nothing abnormal is going on.
While most of what we do here for our animals, as I said, is preventative care, making sure that everything's in great shape and making sure that we catch problems before they get serious when it comes to our animal welfare, sometimes, just like with people, injuries can occur with our animals. And obviously, anytime that there's an injury or a chronic condition, our vet team is on top of it, making sure that that animal receives the best care possible. So we're going to look at a couple of the issues that our vet care team was looking at this week. One of those is one that many of our guests already know about. Aslan, our male lion patriarch, has an issue with one of his legs. Aslan is an older male who is doing fantastically, but when he was a cub at another zoo in Madison, Wisconsin, he was playing a little bit rough with one of his litter mates and unfortunately injured his leg. Just like kids, sometimes the little ones play just a little bit too rough. Unfortunately, the break in his leg was on a growth plate. And a growth plate for any animal or human is going to make it a little bit more difficult to heal. And unfortunately, he's had a limp since he was a little cub. As he's grown older, his vet team, both at his old zoo and here at the Racine Zoo, have always kept a very close watch on that leg. But as he gets into his golden years after having over 35 successful descendants that are all over the country, he is starting to limp a little bit more than he did when he was younger. So every time that our vet is here, he goes and he looks at Aslan, watches his gait, and makes sure that if there's anything we can do for him to make him more comfortable, we are doing those things. Not only is he on anti-inflammatory medication, but we've tried different things like steroid injections and other things that will make him a little bit more comfortable. Most of these things are done voluntarily with our lion participating in his own care, but it is really important for our vet, Dr. Nelson, our vet coordinator, Tiffany, and our primary carnivore keeper, Amy, to meet regularly to discuss his care. These team meetings ensure that Aslan is receiving the highest quality of care possible to take care of that leg and to take care of him as a whole. Just like us, when lions get older, they really do need that extra bit of care. He gets extra vitamins from his keeper, so we communicate with the commissary department, and even our education team is aware when he's having a good day or a bad day. Some days he wants to sit in the sun, some days he'd rather stay inside, and we make sure that when he's having one of those days, we sometimes clear the kids away, give him his space, or let him relax off exhibit inside. Everything about taking care of our animals is about choice and making sure that that animal can make those decisions for himself as well. So far, Aslan's treatment seems to be working pretty well, and he doesn't seem to be in a lot of pain from what our vet has informed us of, and that is great news. We love our lion and want to make sure that he is doing well. Another animal here that has a small issue that's been ongoing for a couple weeks is Wilbur, one of our wallaroos. Wilbur is one of our older wallaroos. Wallaroos are relatives of kangaroos that can be seen out in Walkabout Creek, and he got a little cut on his toe. Unfortunately, again, just like us, when an animal has a cut on their foot, sometimes dirt can get into it and it can get infected, and unfortunately that's what happened with Wilbur. So for him, we actually moved him to a stall behind the scenes where he can relax, stay nice and clean, there's not as much dirt around, so that we can make sure that we can get him on some antibiotics, keep an eye on that foot, and keep him nice and relaxed, out of view of the public, until he's healthy and feeling better. Unfortunately, with our wallaroo, he does not always like to be poked and prodded on the foot by our vet. So if we really want to get a great look at that foot, we do have to anesthetize him to get x-rays. Wallaroos don't really like to hold their legs still. So we get him, we take those x-rays, and we take a really good look at that foot and make sure that everything is healing the way we want it to. So let's go visit our vet team and check out Wilbur right now.
A few weeks ago, keeper reported to me that they noticed one of our common wallaroos, Wilbur, was limping on his foot. After an initial examination, we found that he did have an injury to his toe, and today we are rechecking that injury. Like kids running around, this wallaroo, while hopping around, broke his toe, so we're just checking to make sure that that toe is healing up normally. During the exam today, we are looking to make sure that the broken area is not looking infected, that we're applying antibiotic cream and making sure that there are no additional concerns to the leg or the foot. In addition to examining the toe, we take that opportunity to do an overall body check, make sure that there's nothing else concerning going on that maybe we haven't noticed before. For an exam like this, it often takes multiple staff members to help make these exams go as quickly and efficiently as possible. While the vet is examining the toe and any other concerns that the keepers might have, staff is helping make sure that the eyes have lubrication, that we're monitoring vitals so the vet can focus on the major concern at hand.
My biggest concern is that little piece of detached calcification in bone. Is that unstable and moving around, or reabsorbing? The body's trying to get rid of it, even though there's no indication of infection right now. There's no discharge, no smell, anything like that. So, and there hasn't been, but the big question is the body still going to consider that to be a sequestrum, where it's got to try to get rid of it, or we're hoping that it was going to wall itself off and we wouldn't have to go in there. So I think what we're going to do, I've got it nice and bleeding today, and if by next time that has not gone down further and gotten smaller, then I think I may have to go in there and take that piece out.
Some issues, like that with Wilbur the wallaroo, take weeks of vigilant care and routine checkups. Sometimes issues are quite a bit smaller and just require a quick visit to our vet to make sure that there's no deeper issues. That was the case this week with our African penguins. One of our African penguins was having a small issue on his bottom near his cloaca, so our vet just took a quick peek to make sure that everything was well and good with those penguins. Let's go check it out.
Today at the Penguin Building, we're rechecking a few of our penguins. Recently, one of the keepers reported a minor abrasion on one of their tails, so we're taking a look at that to make sure that it's healing up nicely. As a preventative, we are injecting an antibiotic to make sure that it doesn't get infected. As penguins spend a lot of time in the pool, we want to make sure that no bacteria gets in there and causes a larger infection. Today we're choosing to use an injectable antibiotic as a preventative. Just like in people, antibiotics can make tummies feel upset, and we want to make sure that the birds continue to eat their regular amount of fish to keep their strength up so they can heal more quickly. Luckily, our experienced keeper Heather was here to help us today. Since the penguins are small and accustomed to her presence, she's able to hold them for us briefly while we do a quick recheck. This helps ensure that the recheck process is as least stressful as possible and helps get Dassin back with her colony as soon as possible.
Veterinary care isn't just for our big animals. It's important for the small animals here at our zoo too, like Cheese, our female leopard gecko. Cheese is in her early teens, which is definitely up there for a leopard gecko, and like all other lizards, about once every month or two she sheds all of her scales. Sometimes there's just a little bit of shed left on her toes, and this time she had a little shed left on her toe, and one of her keepers noticed that she had a small cut. And just like anything else here at the zoo, even a small cut is enough reason that we want to bring a vet in and make sure that there's no other issues and that we're doing everything we can to prevent those issues in the future and keep our animals healthy. So Kevin came in, took a look at the shed, made a few recommendations like giving her little foot baths, like a spa day for the lizard, and making sure that we keep that cut nice and clean until it heals up. She's got a clean bill of health and was cleared to continue going on programs, educating kids throughout our community.
I just absolutely love our vet team. They take care of our animals all the time, whether it's preventative medicine, vitamins, things like that that they might need, or it's the monitoring of maybe they had an owie or something like that and our team needed to make sure they take care of them and look at them and monitor progress. So just like a human doctor, our vet team is amazing. They make sure they take care of our animals all the time, and we could not thank them more for that. So next time when you're thinking of the animals, it's not just that we have animals here at the Racine Zoo, but we have staff behind the scenes that are making sure that they are healthy, happy, and amazing creatures. So don't forget, when you come to visit us at the Racine Zoo, we're located at 2131 North Main, just north of downtown Racine. And when you're seeing our wonderful animals and you're walking around the zoo, remember that there's a wonderful vet team right behind those animals that are making sure they're in tip-top condition so that we are taking care of them at the gold standard of animal care. Thanks very much, and we'll see you at the zoo.